Good morning, and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. Paul Thomas and the weary traveler, Bill Kearney, in the studios. Bill,
morning.
Welcome back from the fishing trip, and we'll say so long to New Orleans when we're done with the program. But man, you just are all over the place.
Yeah, I've got to be in New Orleans for a board meeting on Saturday and another one on Monday, and then I'll be back Tuesday. And then I'll be back for 2 or 3 weeks, and then I have to go to Iowa and then Georgia for a board meeting in December. The island I was going to in December got hit really bad by Hurricane Matthew, and so I don't know if it's going to we're going to have it there or not. But I went fishing up in Lewiston and with our Derby Hat Club, and beautiful weather up there. Never caught a fish, never had a bump.
Not even a nibble, huh?
No, it was gorgeous.
What do you use for bait? Are you just spinners?
You use anything you want. It used to be that we had to have a single hook lure, no bait, no nothing. When we were up, we were in Ashland, outside of Ashland at Howard's Ferry. But as the fishing got worse and worse, it was any salmonoid, so any trout, any fish that you could catch was part of the big fish contest. So we weren't even, and we were out there at 7:30 in the morning and till 5 o'clock in the evening. And there's no restaurant or anything there, so you're out there all day, And it's, but it was relaxing. Some people had their cell phones, but there were 4 of us on a boat, and some people had some good luck, and most people didn't. So that was great to get away, and the reflection of the lake was really calm, no wind, 75 degrees, and you could see the leaves were starting to turn, so you could see the reflection of the leaves in the lake. And but it was gorgeous. It was just a beautiful place.
At least it wasn't freezing.
No, it was at night. It got down in the 30s. But we had cabins that we stayed in, and we dressed warm in the morning when we went out, but you started peeling off clothes by 1 o'clock in the afternoon. You were down to a shirt and shorts if you were brave enough to do that. But anyway, it was good to get away, and it's just my travel schedule. I've got to be I'm going from Sacramento to Los Angeles to New Orleans, and then New Orleans to Denver to Sacramento and back. So, and then I think I have a half of a day off. I'm meeting some people there Friday night when I get in for dinner, and that's at 8:15 after traveling all day. So, but this board of directors I'm on does a great job to help community pharmacy and independent pharmacy, and it's certainly worth the time involved. It's just this time of year is so busy with flus and vaccines, which we're going to talk about today, and the change from getting into the holiday season and everything else that's going on, trying to survive in community business. So we're looking forward to maybe getting some rain this weekend and start out the fall season with some moisture, and hopefully that will continue on. Which brings up flu shots and who should get flu shots. And we always have this problem with whether we should get one or not. It's been debated for years. Many medical advocates encourage Americans to get flu shots annually, actually to keep from spreading the virus around during cold season. Skeptics don't trust the ingredients in flu vaccines many times, and many believe the shot doesn't work in everyone. But we think that it's always worth most insurance companies pay for flu vaccine. So just about everybody and every year now, news organizations and explain on what we need to know about flu vaccines. It becomes more complicated every year because they bring out more and more flu vaccines. I'm doing some businesses around and bringing my flu vaccinations to businesses and run their insurance cards through, and almost every insurance card pays for a flu vaccine. But they came out with the main one we've been giving is a trivalent, which means there's 3 viruses in there that they did not change the last 2 years, and this year they changed. And so they suspect it's 60 to 80% effective. It lasts, October is the beginning of flu season, and it lasts up until May. More people need to know about what flu shots are and what you need to get. We are immunizing with the trivalent vaccine, the one that's been on the market for several years. There's going to be a big change in 2017 with flu vaccines, and we're not sure what that will be. We also have reported several times on this program about the spray vaccine, which is FluMist, brought out so people could get immunized that didn't want to get the needle, and it was mainly for pediatric use for children. That flu vaccine has been made the last 3 or 4 years. Last year, it wasn't effective at all. This year, they remanufactured with different strains. It still isn't effective. They aren't even shipping the FluMist this year. So even if you have children, they're going to have to get a shot with a needle. So the push for everyone to get flu vaccine each year makes people kind of wonder, is it really that effective? Is it really going to work? There are skeptics that say it doesn't work, and the pharmacy companies are simply after our money. We make very little on giving flu shots. I have all of my employees are immunized every year. I pay for the immunization. It's important to me that they stay as free of flu as possible, and that they aren't infected so they give any of our patients the flu. So there's a lot of resources claiming that flu vaccines don't work in everyone, and the vast majority of those things have not been backed by science. So we know for sure, and the people that are at the risk the most, of course, are the elderly, those people over 60 years old, and the younger people. A large-scale review of 51 studies published in the Disease of Symptomatic Reviews found that the vaccine was no more effective, the FluMist that we were talking about in children, than a placebo. So the virus that's been used in flu vaccines every year is looked at, and the reason it's changed this year is it looks like it's going to be different strains. That's always a guess. We start this manufacture of flu vaccines a year ahead of time. So we look at what's happening in Australia, New Zealand, and Southeast Asia, and those kind of places, and look and see if as that virus or those viruses progress, how they get muted and change, and try to anticipate what that change is. And we don't hit it exactly right all the time. That's why I was asked actually by a physician yesterday if we had the quadrivalent vaccine, the 4, and I said, no, we don't have that one. And the reason is that last year we didn't get paid for it. This year you get paid equivalent to what the cost is. But the reason was that there's no clinical evidence that we can find that shows that it's more effective than the trivalent when it actually comes to getting the flu. And there's more side effects in giving the medication. Now, all of these vaccines that you give that are on the market are all inactivated vaccines. So you cannot get the flu from the vaccine, which many people won't take the vaccine because they're afraid that it will cause them to get a disease. It doesn't. Some of the live viruses that have more side effects, many times people over 60 years old, if they haven't got the new pneumonia shot, we'll give them the Pneumovax 13 at the same time we give the flu shot. Now, you can't give 2 live vaccines together, but you can give a flu shot, which is an inactivated vaccine, and a live vaccine such as Pneumovax or Prevnar 13 one in one arm and one in the other. And yesterday I did that about 4 times, and I would ask people, which arm do you want to make sure that hurts the least? Because I'll give you the flu shot and the one that hurts the least, and I'll give you the pneumonia shot and the one that hurts the most. Because there's 13 different live viruses in there that go in at the same time, and it's a little uncomfortable to get. Nothing like the old shots used to be. So there should be no problems in people not wanting to get the flu shot. They just, if nothing else, you're trying to protect other people from getting sick from you. One of the comments said, flu shots are like the 2016 elections. They can even end friendships. So I thought that was kind of broad scope and commenting on flu shots, but I'm sure we've all been in that situation during this election process of not wanting to talk about the election in front of friends because of differences in opinion. So, well, luckily we have a little amount of time to do that. Last week we talked about Prop 52 and Prop 61, which are the main ones affecting pharmacy, and Prop 52, of course, has to do with hospitals paying to do Medicaid prescriptions, and you would think that the hospitals would not want to pay for that. The reason they're excited to pay for that is there's not a lot of reimbursement on Medicaid or Medi-Cal prescriptions, and the federal government will give matching funds to people who do that, up to $3 billion a year that is set aside to match what hospitals do. So there isn't any hospital that I'm aware of in the state of California that hasn't endorsed that program. Both the Republican and the Democratic parties of California have endorsed that program, and both sides of the aisle in the House and Senate have endorsed that program. So I definitely would vote a yes on that. The one that you see so much on television, Prop 61, affecting the veterans, one thing you have to understand, this only applies to people who are on state programs that the state pays for the prescription plans. That's about 3 million people, and then another 1.5 million from Medicaid. And what they're trying to do is fix the prices, cost of drugs to what the VA pays and no higher than what the VA pays. The advertising on television shows veterans, and which I'm one of them, during the Vietnam War, and I don't have, I don't use my veteran benefits as much as I should, but we know that's the lowest cost of a drug that you can get. Now remember, this doesn't affect 90% of the people in the country. This only affects, and this is a California-based thing, it only affects the VA program. It's already the best price there is, and what they want to do is keep the drug companies from negotiating a higher price. My feeling is drug companies would be foolish to be raising the price on veterans with all the publicity on how bad that we have been treated as an entity. And Big Pharma is behind defeating this proposition, meaning the big drug companies. So what I advised last week was to roll the dice, because I can't say, they can't show you what kind of a savings it is because they don't know. They can't tell you what the expense is going to be, so you don't know. And I don't think there's any way to control it either way. I think it's like 99% of those propositions that come out. You don't really know what they mean or how it is intended. And usually there's a guide that comes out with when the ballots go out. And I haven't seen that yet. I guess the absentee ballots are going to be mailed out in the next couple of days. And you can read for yourself. And I always say stay informed. There's so many propositions on the ballot this year, it's hard to understand any of them, and that's by design. They don't want you to know what it says. So, again, 61, however you feel, 52 ought to be a yes for everybody because it doesn't hurt us. It helps the hospitals survive. And if we're in any kind of a dilemma right now in healthcare, it's designing whether or not we're even going to have a healthcare program. If you watched the last debate, that was a major thing that they were talking about, Obamacare. Nobody can argue that it's been more expensive. It's cost us more money. If you'll remember, Obamacare was the bill that we were told by the administration, don't read it, just sign it. And there are still parts of Obamacare that haven't been implemented that's going to cost us millions of dollars as taxpayers. If you want to give 3.8% of your gross sales of your house when you sell it to Obamacare, that's what the law requires right now. So one party wants to repeal it and start over. The other party wants to change parts of it. Whatever it is, the healthcare system is broken, and it was not fixed by Obamacare. And we need to look at, I just saw Kramer, who's one of the financial investors that's on MSNBC and MSN, says, don't buy any drug stocks until after the election because you have no idea where it's going to go, as most of us don't. So it's going to be a rapid change when the election takes place, whether you think it is or not, no matter who's elected. There's going to be an implementation of things that we're going to have to get used to again. Hopefully they're positive, but at this point we just don't know. Paul, we've talked about Parkinson's disease before, and I've talked to groups here about in Lake County about Parkinson's disease, and they're the most energetic, positive group of patients that I've talked to, and most survivors are cancer survivors, Parkinson's, MS. And it's a chronic disorder of the nervous system, which means it doesn't have a cure. It involves shaking and stiffness and trouble with walking and balancing, coordinating. It's caused after nerve cells in the brain fail to produce enough dopamine, which is believed to result in the symptoms that affect the bodily movement. The initial symptoms are difficult to spot because as we age, many of these symptoms are just going along with the aging process. But there are symptoms of this disorder that begin gradually and get worse over time. Apart from affecting the brain, Parkinson also affects the entire body. And Lewy body dementia and Parkinson's was what Robin Williams had. It isn't curable. It's treatable, and the treatment is not long-lasting, and you have to keep increasing the dosage of it. So according to the National Institute of Health, about 60,000 people in the United States are diagnosed every year. In some cases, it's genetic, but in most instances, it's not hereditary. They said exposure to chemicals in the environment may also play an important role. You know, I don't know. I went to the dentist yesterday and I had X-rays. I must have had 20 X-rays because it had been 2010 when I'd had my mouth completely restructured from bruxism and grinding my teeth down at night. And as I had these X-rays, I asked the technician, I says, does anybody ever complain about having X-rays? And she said, all the time. And she says, you can get more of the toxic rays standing in front of a microwave for 5 minutes than you can get taking X-rays the rest of your life. And I think about all of these things that are probably affecting our life and causing cancer and causing a lot of these things. And because I don't remember very many people when I grew up, Paul, of having Parkinson's disease. Do you? I mean, when...
No, not really. I mean, nobody in my immediate family did.
And maybe they had it and they weren't diagnosed. I don't know. But it seems to me like a lot of these muscular sclerosis and Parkinson's disease and a lot of these neurogenic diseases, of course, I grew up on a farm and I didn't have any exposure to a lot of the things that other people had, but I also grew up on a farm where we were spraying crops with a 50-gallon barrel full of DDT and malathion that was just soaking us to the skin.
Oh, yeah.
So I can't help but think that might have been a problem as well, but that certainly is exposure to chemicals that are not allowed, especially in California now, there was no restraint on them back 60 years ago. So, but early signs of Parkinson's disease, and when I talk about these, I want you to just think about them because a lot of these things just start happening. Tremor or shaking. At my fishing thing, we brought in a newer, most of us are getting older now, so we brought in a newer member, and so he says to me, Billy, why are you shaking? And I said, because I'm old. Well, I have a disease called essential tremor that causes my hands to shake, and if I take the medication, it's fine. But towards the end of the day, that process gets worse. And so I don't think I have Parkinson's. I think I have, this thing that's controlled by, but one of the samples of that's causing Parkinson, or one of the symptoms are tremors, small handwriting. I always remember a friend of mine who was a medical professional that had a brain tumor, and didn't know about it, and as that tumor progressed and him writing prescriptions, his writing got smaller and smaller. And the same thing happens with people with Parkinson's disease. Loss of smell. That also happens as you age, as well as a symptom of Parkinson's coming on. And that affects their diet lots of times because they're not as hungry when they can't have that sense of smell. Trouble with sleeping. Also a problem as the aging process continues. Difficulty in walking or even moving. As we get up and the arthritis becomes so severe that you hurt every time you move, that also could be not Parkinson's. But you put all of these things together, constipation, another age-related thing, but also a Parkinson's symptom, maybe from the medications you're taking, as well as your body just not functioning like it does when you're much younger. Soft or low voice, I'd never heard this before, but again, one of the symptoms. Sad or depressed face, even when you're in a good mood. Again, it could be a symptom of Parkinson's disease. Fainting or feeling dizzy, or stooping or slouching over, again, one of those things that could be in the aging process as well as a symptom of Parkinson's. So in this age of computers where we think we know more than doctors, and we start seeing these symptoms and we look at ourselves and then we hear something like this and we think, oh my God, I've got Parkinson's, and there's ways you could be tested for, especially for dopamine levels, and find out if that's the case. But just something for information more than anything else. And a lot of our listeners that have a Parkinson's disease can relate to a lot of the things that we said. We're going to take a break, and when we come back, we're going to talk about some things related to sugar versus fat.
Hi, my name is Bill Kearney, pharmacist and owner of Northlake Medical Pharmacy.
I'm sure you've seen and heard the recent advertising from the pharmacy chains in the area telling you about a special price for the generic prescriptions. And if you've been a customer of an independent community pharmacy and you've probably wondered if you could have to change to a chain pharmacy to get a special price on your generic prescription, the answer to that is no. Northlake Medical Pharmacies, in conjunction with Good Neighbor Pharmacies, has their own prescription card savings plan. From an inventory of over 300 generic prescription medications, you may purchase a 30-day supply for only $4.99 and a 90-day supply for $10.99. There's a one-time charge that will be charged off your first prescription, and that is the fee to enroll you in our program. So whether you're a brand new patient, Medicare D patient, or just a cash customer that has no insurance plan, come see us at Northlake Medical Pharmacies on Hill Road next to Sutter Lakeside Hospital or outside the Bruno Shop Mart at 347 Lakeport Boulevard.
In the past, when a musician or band recorded a song that was worth owning, people would buy it. And that inspired artists to create more music. It was a rewarding time for both artists and listeners. Today, many music lovers refuse to pay anything to own a new song. Why pay for music when it can be downloaded illegally for free? When you download music illegally, you're stealing, and it's not a victimless crime. You're denying payment for work that rightfully belongs to the artist. So please, don't download music, movies, or software illegally. Do what's right. Pay for them. Get them legally and support aspiring artists who are busy creating your next favorite song.
Illegal downloads hurt, but you have the power to stop them. To learn more, go to www.ncpc.org/getreal. That's ncpc.org/getreal. Brought to you by the National Crime Prevention Council and the Bureau of Justice Assistance, U.S. Department of Justice.
Whether you remember poodle skirts, mini skirts, or bell bottoms.
You're just the right age.
Whether you like Ike or love Lucy.
Your help is needed.
Even if you're in your 50s, 60s, 70s, or beyond, you can sign up to become an organ and tissue donor.
Think you're too old? Think again.
Any age is the right age to donate the gift of life.
Sign up today at organdonor.gov or call 1-866-99-DONATE.
A message from the U.S. Department of Health and Human Services, Health Resources and Services Administration.
Out on the golf course, there are the obvious hazards. There's the pond, the bunker, the rough, the even rougher.
Yeah, put me down for an 8.
The giant maples, the row of houses out of bounds on the right, the angry flock of geese who surrounded your ball, even the occasional groundskeeper you had no clue was there. But if you think you found every possible hazard out there, think again. The hazard you missed could actually be a killer. It's the spot on your skin, the one that could be skin cancer. Fact is, if you're a man over 50, you're in a group most likely to develop skin cancer, including melanoma, the kind that kills one person every hour. 1 in 5 Americans is likely to develop a form of skin cancer during their lifetime. That's why your best shot is to check for a spot. It's easy. Follow through and check your skin. It could be the save of a lifetime. Go to spotskincancer.org to find out how. A message from the American Academy of Dermatology.
Alrighty, we're back.
Well, we were talking about, when we came back to talk about sugar versus fat and if we've been misled. Because a lot of people are disappointed if they've been watching their sugar and they haven't been watching the fat, and they thought the sugar was really what caused them the problem, but there's a lot of that information is being replaced. The basic 4 recommendations that were in place was based on 5 main food groups: milk, meat, fruit, vegetables, grains, fats, and sugars. The basic 4 was milk, meat, fruits, vegetables, and grain products, which promoted consuming a minimum number of servings from each food group to ensure a person would get all the essential nutrients. Those were in place for a number of years until the Surgeon General report on nutrition and health relied heavily on low-fat food consumption and an overall decrease in total fat and saturated fat. They often overestimated serving sizes, consuming more than this food pyramid had explained. The manufacturing industry was flooding the market with low-fat and fat-free products, while many consumers did not know that that fat is often replaced by sugar to enhance the flavor of a product, and nobody really thought about what the sugar was doing. So many people began to gain weight as a result of overconsumption of high sugar, fat-free products. And because it was fat-free, they thought they could increase the portion size. So as a result, the pyramid was replaced in 2005, which was designed to emphasize moderation and equal portions of food from each group that people would be consuming every day. So it depends on 5 food groups now: fruits, vegetables, grains, protein, and dairy. And there are a lot of people that will tell you to avoid dairy in the medical profession. So relatively equal amounts, reminiscent of the basic 4 from 50 years ago, when our country wasn't faced with the obesity and chronic diabetes epidemic that we have today. So what we're hoping for is trying to decrease the incidence of cardiac health death, and it's still the leading cause of death worldwide. While the consumption of carbohydrates and their role in cardiac health death is still hotly debated, we know that refined carbohydrates in food and sweetened beverages can increase the risk for disease. As a new result unfolds, it will be important to look into finding sources that we can take to avoid this. If you're like me, you've been on every diet that there is, and I went on the carbohydrate diet and no carbohydrates and eating fats, and lost a ton of weight. But every diet that I've been on, I gained the weight back. And the minute you start eating normally, I was on a 500 calorie a day diet when I was taking an injectable HGH drug, and I lost 40 pounds. The minute I got off of that diet and started eating normally and less portion size, I gained the weight back twice as fast as when it took me to take it off. So you either have to change your diet and be on that diet the rest of your life, or exercise a lot more, or do, as we look at almost every kind of disease state, the best way that we can cure it is diet and exercise, diet and exercise, diet and exercise. So what we're hoping for is that that message will get out. Most people that are obese do not want to exercise, or they're so obese that it hurts when they exercise, and they don't want to hurt, so they don't walk, they don't get on the treadmill, they don't do those things that you're supposed to do, they don't eat properly. There's a big difference in actually where you're raised and what could be causing a lot of that. In big cities, for example, you really wouldn't think this, but it almost goes against reason. But according to a new survey, people who live in certain large cities in the United States are generally healthier than those who live in rural areas. And I'll tell you why. In one sense, of course, you would think because of the toxic chemicals and everything that are in the air in the big cities that might cause a health problem. But if you ever go to San Francisco, you ever go to Denver, you ever go to... I was talking to somebody last night. I lived in Denver for a while and worked for Walgreens for a couple of years. And I also lived in Chicago, and that's where I started my career. And I always noticed in the wintertime in Chicago, nobody would go outside their apartments or their homes. They'd stay inside. They'd shovel their sidewalk, and that's about all they did. I moved to Denver, and in Colorado, everybody's out in the wintertime. Everybody's out skiing, everybody's out doing things. If you go to San Francisco, you will see the parks full of people. You will see runners. You'll see, and we have a lot of that around here. There's a lot of people. I live in an area out by Canocti that every morning there are people walking, and most of them are elderly. and they're walking their dogs, they're walking themselves. But there are communities like where I grew up where that really doesn't happen, and they don't even think about. Of course, there are no sidewalks or parks or those kind of things. And when we're building homes in cities now, we have green belts where people pay attention. The survey showed that the cities that have lower than average rates of smoking, obesity, diabetes, depression, cardiovascular risk factors like high blood pressure and high cholesterol scored higher than average for walkability, easy biking, access to green spaces and public transportation. Cities that had the lowest in the survey, there was more of those conditions, and the ones with the lowest amount were like Tulsa, Oklahoma, Durham, North Carolina, Indianapolis, Oklahoma City, and Fort Wayne. According to the survey, the smaller communities also take measures to improve health. Options include adding bike lanes and sidewalks and adopting policies to reduce smoking and encouraging local grocery stores and restaurants to provide healthy food shortages or choices. So we do know what to do. It's whether or not in an area like this where we have a low density of population, I'll never forget when I first hired the board of directors first hired a CEO at Sutter that was into wellness, and I kept telling her, we're not ready yet. You know, you can't take a small rural farming community and say, we're not going to treat your disease. We're going to keep you from having that disease. Well, this isn't a younger population, and when you take people that are already ill and you tell them we're going to keep you from getting this disease and they already have it, number one, in a small community like this, you have to raise revenue. You have to bring people into the community. You have to support it. And the people that had the money were the older generation, and they didn't want to invest in wellness, and it takes a long time to get that. If you're in business and you happen to have, for example, maybe an organic grocery store or a vegan restaurant, there's not enough population to support it in a community like this, and so you're taking a big risk. Yes, you can market. Yes, you can make things a lot more available, but when you're an independent business person and you have to succeed, no matter what your belief is in being healthy, it's difficult to get that across in society. And I guest lecture at Marymount a few times a year, and I talk to people about being in business and being healthy, and what mistakes you can make if you don't really do your research in opening a business. And I failed to do that when I came to Lake County, and I was instantly in trouble after 3 months and had to take some serious steps to be able to survive here. So being in a city for a lot of people is healthier than being in a rural community. I don't think that's the case here. I think that if you go to the parks, I go by the state park every day. I see 5, 6, 7, 10 cars parked out there where people walk every day. My other store out by the hospital, I see people walking that circle on Hill Road East and Hill Road West all the time. And we have a good amount of bike lanes around, and both in the city and out in the county. We just had 600 bicyclists here the first week in October. Maybe not the best, but availability for people to ride their bicycles and get healthy. Plus, we have several health centers here that do the same thing. We were talking about Parkinson's disease and how what the risks are, and one of the things that came out it happens to be Dean Adele's Health Central, was about high blood pressure increases dementia risk. In middle-aged adults, it raises the risk for dementia and cognitive decline, according to the American Heart Association. Research shows that the strongest association between hypertension and vascular dementia, which is the second most common type of cognitive impairment. We're talking about, the first step from Alzheimer's. Lifestyle changes and medications to lower blood pressure can reduce the risk for heart complications like stroke and heart attack from hypertension, but at this time it's not clear whether the treatment reduces the risk for cognitive complications. And cognitive complications are things like daily tasks that you perform. Can you feed yourself? Can you cook for yourself? The latest research in the Journal of Hypertension about people diagnosed with high blood pressure and or dementia should follow their health care providers' recommendations for treatment, and more research is needed. Well, here we are in a society that, you have to find a cardiologist. You have to find a general practitioner. You have to find an internal medicine doctor. You have to find somebody that's going to be able to repair your shoulder or your leg or your neck or your spine. And as conditions in healthcare worsen, there's less of those people available, not just in small communities, but all around. There's a lessening of people wanting to go into medicine today. And, of course, rural counties take the biggest hit. So we have said many times that healthcare is changing, and you're going to have to get more involved in your health. Yesterday, I had, probably 14 flu shots I gave, and out of those, 4 of those people I also gave Prevnar 13 to, the pneumonia shot, because they were over 60 years old. They'd had the first pneumonia vaccine, the Pneumovax 23, but had not had the 13. And so as they came in for their flu shot, we had a questionnaire, and we asked them, have you had your flu shot? And if they said they had had one before 2014, then we gave them the other flu shot. With Medicare, you can have, they will pay for any kind of pneumonia shot once a year, and so we were able to have 4 of those people, and 2 of those people really needed, had prior cases of pneumonia, and it was something that we try to do when we see that there's, if you haven't had a tetanus shot in the last 10 years, we want to make sure that you get the opportunity at least to get a tetanus shot. You don't need a prescription for these things. Pharmacists are allowed to give these medications when they're indicated. And I saw this and I had to print it out because I thought it was a little unusual, and it said, "Are you sick because of fall?" And for most people, the transition from summer to fall is welcome. I just love getting up in the morning and sleeping well, because it was, the temperature was down. You could leave the window open and you go out and breathe that fresh air in the morning, and it's very invigorating, the autumn season for me. But uncomfortable heat and humidity are replaced by cooler, crisper days, often filled with sunshine, a beautiful color like I experienced last week. But the change in conditions sometimes can make you sick. So it's not the colder weather that makes you sick, it's being inside more. So, and usually if you're elderly, that occurs more often than not. And that can increase the transmission of disease, like we were talking about flu shots. Being stuck inside, often in close quarters with others, can increase your exposure to sickness, causing germs, and the drier air, both inside and out, reduces the healthy mucus in your body before leaving you more open to disease. Yesterday I was giving shots. I just gloved up and went to get the syringe to put the needle on for the pneumonia vaccine, and I sneezed. I was all gloved up, ready to go, and I had to start all over again because I always put my arm up to, or my hand up to suppress the sneeze, and so I had it all over the the gloves, and I had to take the gloves off and re-put on gloves and wash my hands and go back to do that because people are more susceptible, and here you are giving them a preventative shot, and you're exposing themselves to more bacteria. So if that dry mucus is a problem, get up a humidifier to keep your respiratory system from getting dried out, and wash your hands. If you can do anything, I talked to a lady last night, said she wasn't going to get a flu shot, and I said, why? And she says, I just don't want to put anything toxic into my body. And I said, well, this is a preventative. She's into natural medications and alternative meds, and I have no objections to that at all. But you're going to expose yourself to other people, and unless your immune system is up to where it should be, you're going to be a carrier probably to pass something on to somebody else. And of course, we don't want that. You don't want that. And it's one of the ways that you can prevent transmission of diseases. We have Zostavax for people who are afraid of getting shingles. Now, you can't get shingles from somebody that has shingles unless you get that exudate that comes out of those sores on your skin. That can transfer it to you, but just from breathing next to them, you can't. What brings on shingles, and you don't have to be 60 years old. Unfortunately, the insurance companies think you have to be 60 for them to pay for the shot. But what you have to do is, if you get shingles, you usually get it from stress, from sun, from exposure to chemotherapy, a lot of different things. We don't know what the triggers are. And we have young people that have had, and you've heard me talk about my sister, had it for 8 years now, got it in her eyes, and she still is battling it with Bell's palsy. But when you get an opportunity, because the shot is expensive, it's $220-some to get a Zostavax shot, and I think we're probably the least of anybody around when it comes to the cash price. But it will give you a 60 to 80% chance of not getting the shingles. And even if you've been exposed and you have an active virus in your system, the ability for it to be as intense as it would be otherwise is diminished considerably, meaning, you may not even have the blisters come out on your skin. You've seen the ads on television, and those are not exaggerated. Those are exactly what it looks like in full bloom. So all you have to have is a fan on you or a shirt or a blouse touching your skin, and you can go into orbit. It's very, very painful at a full bore. So anything you can do to diminish the extent of it and the length of time it stays in your system is well justified. If you've ever seen anybody, or if you've had it before, you can still get the shot. Now, it's not as effective as we'd like it to be, but they're coming out with a new formula, and it's an active vaccine. When I put that vaccine in your system, it has been frozen until 30 minutes before we give that shot, because it has to be frozen to be stable. Then we activate it with a 0.6 of a cc of water, and then we inject it in subcutaneously into your skin, and it takes it about 2 weeks to work, but it's very effective. And I've only had 2 people that have really had a case of shingles that had been immunized by me that I'm aware of, and it wasn't severe at all. It was maybe 2 or 3 days. I've had people that have gotten shingles and had cancer, and the cancer was cured, and they still had shingles when they passed away. So it's something that you really need to think about when we get into this society that, you're the most responsible person for your health. You're not going to have that concierge-type doctor that made house calls back 50 or 60 years ago and really looked into your health. You have to look into the health yourself. So be thinking about that as we get into a new year, and as you change health plans. October 15th is the time that they open up on Medicare D. It's open until December 7th, and you have the opportunity to change the health plan you're on. Look at the premiums, go on Medicare.gov, check and see what plans are available. It will isolate it to your zip code, and it will put plans that are only available in your area. Or you can come in and talk to us at either one of our pharmacies and make an appointment. Let us know all the meds that you're on, because they may not be on the formulary. When it comes to the same plan that you had before, the premiums have escalated, the co-pays have escalated, and a thing called DIRs, which are charged against the pharmacy, have escalated too. So we see a lot of companies changing formularies now from the more expensive meds to less expensive medications. We see them having closed networks where they won't allow certain pharmacies, independent pharmacies, to compete. Don't let that scare you away. The difference is very small in most cases. If you want an independent pharmacy to stay around in Lake County, then you need to support the independent pharmacies that are here. So we have one in Lucerne. I have two, one out by the hospital, one in Lakeport at Bruno's Shop Smart Shopping Center, and then we have one in Kelseyville and Hidden Valley, so and Lucerne. So think about the difference in a place like North Lake Pharmacy. We deliver to you. We delivered through Kelseyville, Buckingham, the Rivieras, Lakeport, Nice, Lucerne, Upper Lake. Just let us know a day ahead of time when we're getting into that rainy season. Starting tomorrow night, probably it'll start raining. I'll be in New Orleans with sunshine and humidity. So I'd like to remind you, we're North Lake Medical Pharmacies with two locations for you. 5136 Hill Road East, across from Sutter Lakeside Hospital. Call us there at 263-6192, and come in and get your flu shot. And also at 347 Lakeport Boulevard, outside of Bruno's Shop Smart, give us a call there at 263-1328. We're open Saturday mornings also from 9 to 1 at the Bruno's location. So thank you, Paul.
Thanks, Bill. We'll see everybody back here again next Wednesday for Health Talk on AM 1270 and 96.5 FM. KXDX Lakeport.